Well, we are live now. Hello, fellow revolutionaries. I'm Supreet, again from Our Revolution King County, and we have Rhonda from Our Revolution Washington Berniecrats Coalition. And we are now on our second meeting in the series of building a progressive platform for the state of Washington. So today's topics are women's rights and LGBTQ rights, and I'll jump right into it. Okay. All right, to start with women's rights, the goal is to create a society in which women, including Black women, Native women, poor women, immigrant women, disabled women, Muslim women, lesbian, queer, and trans women are free and able to care for and nurture their families, however they are formed, in safe and healthy environments, free from structural impediments. We recognize here at Our Revolution that systemic problems cannot be solved by individual actions. We need systemic collective actions to solve them. In keeping that in mind, here's a list of problems that we hope to address: reproductive rights, economic opportunity, ending violence against women, trans women are women, standing for our Black sisters, standing for our Latin sisters, standing for our sisters abroad, standing for our Native American sisters, and constitutional equality. So Green Party platform, which we found to be very Rhonda, I can hear my echo. Okay, it's no longer here. The Green Party platform for women's rights is the one that I found to be the most comprehensive. So we are going to draw a lot of inspiration from that, and we have also added some things of our own. Starting with social equality, we want the Equal Rights Amendment to be ratified immediately. It's insane that we have to say this. Enact electoral reform like proportional representation and public financing of elections that lead to more equal representation of women in all levels of government. Promote political equality of women in government and community leadership and gender balance of leadership positions. Provide access to equal education for women in the United States and across the globe. Ensure the workplaces are free from sexual harassment and job discrimination. As a part of our platform, we'll demand that our candidates set up sexual harassment offices within their campaigns to make sure there is a way to redress complaints in a safe manner. And we also support public and nonprofit programs to help mothers care for themselves and their families. A big part of that is public child care. That one of the candidates running in CD8 has, that's Robert Hunziker. He's for public universal childcare, and that is something that we like to get behind. Economic inequality. Before I go ahead, I would like to address why all of this is in here. It's because as much as we'd like just voting for women, no matter what, does not solve systemic problems, because not every woman will enact laws that would lead to enfranchisement of women in politics. Keeping that in mind, we have to support candidates, any candidates running without corporate money, who will work to address these systemic issues. The reason why we add without corporate money is because that's how we can trust them. Candidates will say whatever they need to say to get elected. We have had this happen for decades, and now we want candidates that have a spine and that we can trust. So that is absolutely the #1 requirement for us. Economic equality, enact federal and state laws to achieve pay equity and provide funding for enforcement of such laws. Enact reforms to end poverty and return dignity and opportunity to all mothers and their children. The second point is here specifically because there is ample studies showing the impact that early childhood education and the first few years of a child's life, the impact that they have on their future, their capabilities, the opportunities, whether or not their propensity for violence, environment comes into all of this. So making sure that every child has a healthy nutritional meal, has access to childcare, affordable childcare that is equitable, and has access to equitable education that is not just preparing them for a job, but preparing them to be leaders in their community. And that is absolutely essential to create leaders, both men and women of tomorrow. Enact a guaranteed basic income, which should be livable. $15 minimum wage is a great place to start, but in many parts of the country, that is not a livable wage. So we'd like to create a livable wage, a federal minimum wage of $15, and let the states increase it as they see fit, and also tie it to inflation, so we don't have to do it every 10 years. Reproductive rights. Ensure that a woman's right to control her own body shall never be compromised. I like to phrase this as bodily autonomy rights. And we don't argue on autonomy rights in any case except for the woman's right to choose whether or not to have a child. We have to recognize that there's economic barriers, social barriers, especially where our society is right now, that does not make it the right time for most women to have children, and some just don't want to, and that should be their right anyway. Women are not just vessels and carriers to create more workers for the capitalist system. They are full human beings in themselves, and they should have complete right to their own body. Ensure that women have the choice to have a safe, legal, affordable, and accessible abortion, regardless of age and marital status. And I'd also add here, I'll take a note, and where they live, location, regardless of location. Next, we have support safe and legal accessible contraception choice, regardless of age and marital status, again, location. And I would also add sexual orientation, gender identity. Support contraception and abortion coverage in all health insurance policies. We think the only way to do this is by having a single payer healthcare system, because if there is single payer healthcare system, which is managed by the federal government, not like single payer just means that there's one payer, and many corporations are now twisting it to say we should be the only payers, and that is not the right way to go. So single payer.
Let's put universal health care, single payer.
Yep, universal health care. All right, and ensure all health insurances policies cover family planning, reproductive health care, and services are universally available. And I'd add with enforcement for, actually I think this would be solved if we have single payer health care. So I'm gonna leave that there because it's a complete, that is the first requirement of this platform. Ending violence and oppression, establish public education programs to address the root cause of all violence against, all violence, including violence to women and girls. Ratify the Convention on the Elimination of All Forms of Discrimination Against Women. Put an immediate end to international and domestic trafficking in humans through stronger enforcement of existing laws, passage of tough new laws, increasing punishment to traffickers, improving aid to victims, increasing public awareness, improving law enforcement, and reforming immigration laws. What we mean by improving law enforcement is including training and dedicating funds to addressing this immediate problem. Support the state departments, this is specific to Washington state, support the state department's annual trafficking, I am so sorry, this is State Department federally. Annual Trafficking in Persons report as an important document to begin to combat this abuse. We support and urge enforcement of Victims of Trafficking and Violence Protection Act. So it's been signed into law, it's not being enforced. And then standing up with our trans sisters. We endorse the Equality Act, which expands federal protections. All federal protections include Civil Rights Act, the Fair Housing Act, Equal Credit Opportunity Act, the Jury Selection Act, and Services Act. In all of them, we want provisions for sexual orientation and gender identity. And this also amends the Civil Rights Act of 1964 to put to prohibit discrimination based on sexual orientation and gender identity. Also, Equality Act would update public spaces and services covered currently to include retail stores, services such as banks, legal services, transportation services, etc. In addition to all of this, we also have a comprehensive LGBTQ plus platform that we know, and we understand that it is not a single issue platform. We have to address all these different issues which affect so many of our sisters in so many different ways. Now moving on to LGBTQ rights.
Well, before we go on to there, can we make sure that we mention or reach out and get some things in there regarding the murdered and endangered Native women?
Absolutely. I'll make a point. I had standing up for Native sisters, so I'll just create a new slide.
Sorry, I just want to make sure that part got in.
You're absolutely right. What could you please repeat that?
It's murdered and endangered of our Native women. It's bad.
Do they have a platform? Like, what do you have any
I will look.
information on? Okay.
I will look.
We want to figure out how to address this policy-wise.
If I can't find it right now, I will make sure I reach out to the groups that went out for the Women's March and make sure we get one.
Yeah.
Get there.
Absolutely. Ending violence and oppression in that, I think we should add this part. Because this is violence against.
Yes, that's a good place to put it.
So I'll take this as an action item. This is something we need answers on. Alrighty, anything else?
No, murdered and missing, maybe that's what it is, but I'll find out for sure.
You're
no,
right.
not,
You're right. It's murdered and
missing.
missing. Yep.
Yes.
Yep. I remember it now from the Women's March.
Yes. Not to say that they're not getting endangered either.
Mm-hmm. I'll find a better way to put that after the meeting. And
yeah,
also, I know that this I did not have a slide for our African American sisters. That's because we did have a platform, a meeting on racial justice, and in that we, as a part of that, we endorsed the movement for Black Lives platform, which has a lot of platform which address violence against Native women, all sorts of violence, economic, social, political, racial, and environmental. So that is also endorsed. If you want more information, please go check out our video on racial justice. And reach to us at washingtonberniecrats@gmail.com if you want if you want it to be mailed to you. We can email the platform that we have. Now moving on to LGBT rights.
Yes.
Where is the slideshow? Alrighty. So the goal, I'm so sorry, this is not the right goal. I meant to create it, so I'm just gonna create this right now. And the goal is to create an equitable society free of systemic impediments and violence. Okay, so for this, we recognize that both of us were cis women, so we reached out to the Seattle LGBTQ Commission, and they had a meeting tonight and could not join us, but we went through their platform and have taken their recommendations. So to that note, we'll start with the Seattle LGBT Commission recommendations. First is federal LGBTQ protections. While Seattle is much better in this regard, oh no, slide, sorry. Much better in this regard, it does not render its citizen immune from the effects of federal agenda. So this is what we recommend. Immigration issues for LGBTQ individuals who do not fall under stricter family member definitions, because we have to recognize that in other countries, it's still illegal in a lot of different countries, and it was illegal here until a couple of years ago. So now that we have made that jump, we should make sure that people who are seeking safety from violence, wherever they're born, just like I was seeking safety from gender violence in my country, I came here, and we want to make sure that the door is open behind us and we are not burning the bridge. So immigration issues for LGBT individuals, rollback of Title IX protections. So we want to push back on these. We don't want to roll back. We want to push back on Title IX protections, roll back on college campuses. We want to push back against the repeal of healthcare protections guaranteed in ACA, and we want to push back against discrimination against trans military personnel. And we also endorse the Equality Act that I mentioned before, which would increase federal protection for LGBTQ folks in all the civil rights acts and bills that we have. Housing and homelessness, an estimated 20 to 40% of homeless youth identify as LGBTQ. With this in mind, the recommendations were the following, and we endorse and adopt them. Allow individuals to self-identify when accessing services so we can track the overlap better and we have better numbers to address it. Protect safety at sanctioned encampments. Recognize chosen families at shelters, because our idea of what a family is very privileged. We must address that, because people on the streets, if they find a young person who's also homeless and take them under their wing and want to support them, they are their chosen family, and we should recognize them that at shelters and not separate chosen families. Develop policies for unsanctioned encampments that center dignity and stability, and stop the inhumane homeless camp sweeps. Assess and eliminate barriers to homelessness services, particularly for binary gender and non-gender conforming individuals. Train staff and service providers, ensure compliance to these rules. Work to ensure no Seattle residents are denied housing due to gender identity, sexual orientation, or HIV status. By work, we mean that we want legislation from them to stop it, and with strong provisions for enforcement, and create policies to increase supplies of and access to affordable housing, both in short-term and long-term. And we have a comprehensive platform on housing and homelessness that we'll address later. We haven't gotten through it yet, but that's where, this is what that's referring to. Drug use and safe consumption sites. An estimated 20 to 30% of LGBTQ community have substance abuse issues, as compared to 9% of general population. We recognize that, not only do we recognize there is scientific literature available on the fact on how economic violence and unstable, non-traditional households that are cause of poverty and segregation. Gentrification is basically segregated society. What it does is it increases your propensity addiction, and it's not that they are more likely to do drugs. Anybody who's poor and lives in those conditions is more likely to get addicted because of there's so many stresses in life, and we want to address that. And our recommendations are as following: advocate for, implement, and properly fund safe consumption spaces. Again, they should be public, never privatized. Improve HIV prevention, care and treatment among substance users, including persons who inject drugs. In rehabilitative spaces, allow individuals to self-identify and recognize chosen families again. Allow families to visit irrespective of biological relations.
So with the slide before, you want to switch out Seattle to Washington?
Which one?
Yeah, down here, the second to the last, it says to ensure no Seattle resident. Do you want to change that to Washington?
Absolutely, Seattle, Washington residents, you're right. Yep, this was a more local platform, but this applies. This could go now.
Right.
You're right. Is there anything else I missed?
No, that's all that jumped out at me.
Thank you. Okay, hate crimes and social justice. Hate crimes in Seattle have risen 139% when comparing to first 6 months of 2016 to the first 6 months of 2017. Many in the LGBT community have intersecting identities that lead them to not report hate crimes due to lack of trust with Seattle Police Department. We recommend the following. Again, these are recommendations from the Seattle LGBT Commission, and we are not just recommending that, we are adopting this as our platform. Increase oversight capabilities of Community Police Commission. Support CM Herbal's audit of hate crimes, and pledge to take actionable steps to combat this rising tide. This is more local, I know. Work directly with, but that's the whole point. We want a national, state, and a local platform. Work directly with communities of color to find solutions that most directly support LGBT individuals of color. This may include supporting community-based policing or other changes in training or oversight. Support victims of sexual assault and revise city policies with respect to accusations of sexual assault by city employees. The recent revelations in the Capitol Hill have shown us that the worst place, more than the tech industry and the Wall Street, the worst place right now for women is the Capitol Hill. It's because there is each office is just left to do their own own investigation, and we need to have separate offices to report discrimination, not just on gender and gender violence, but also based on sexual identity. Implement protections for trans and non-binary individuals who are jailed or incarcerated. For example, make gender-neutral holding cells available, ensure access to necessary medical therapies and treatments, work to reduce prison sexual abuse. I want to eliminate it. Why reduce? We want to, I'll just change that, I'm sorry. Eliminate prison sexual abuse, which disproportionately target LGBTQ individuals. Trans health and trans rights. Trans and non-binary people have much lower life expectancy than the general population, often reported to be in the age of 30 to 35 years. This is attributed both to high rates of suicide attempts within the trans community and high risk of being victims of homicide, especially trans women of color. Our recommendations, their recommendations in our policy adoptions are as follows. Work to extend trans life expectancy through increased access to mental health services. Instead of that, increased access, I would like to say through single-payer healthcare system. Single-payer universal.
Yeah, it's more universal.
I have to mention this every time because everything we come up with is manipulated and used. Universal healthcare system. Combat rising hate crimes, particularly against trans women of color, see in the previous section. And support insurance coverage of, not just support, let's see. Yeah, this would be included in our healthcare bill, but support insurance coverage of and broad access to trans healthcare needs. This includes, but is not limited to, gender affirmation surgery and treatment, fertility and assisted reproduction needs, procedures that insurance may have previously designated as for a single gender, example, pap smears for trans men. Support efforts to further study and combat discrimination against trans and non-binary individuals, especially within the workplace. So again, I know there's access to healthcare a lot of places, but we at this coalition, when we're building the platform, we mean to address all of these healthcare needs through a single payer, publicly funded healthcare system. Moving on. HIV stigma in people living with HIV. The LGBT community is disproportionately at risk of contracting HIV, yet even with recent great strides in medicine, many still face barriers to treatment. Keeping this in mind, they recommend and we adopt the following. Improve HIV prevention, care, and treatment among substance users. It just falls out of my mouth because of the conditioning. Substance users, including persons who inject drugs. Increase access to safe, stable, and affordable housing for PLWH and people at risk for HIV. Improve sexual health education, physical and behavioral health services, and social supports and intervention for Seattle youth. We at this coalition also support a publicly funded program in public school on human sexuality, which is more comprehensive and takes into account modern strides in medicine and scientific innovation. We like now studies have taught us so much more that was wrong, that we're still being taught in school, basic school science, and that leads to misconceptions about sex and gender identity, and it leads to a lot of self-hate and depression for the youth. So we support a publicly funded program in public schools.
Make sure you put either just youth or Washington youth, or like I said, we can always adopt it.
Okay, absolutely, for Washington youth. Is there anything else? There's Seattle. Nope. Invigorate and strengthen meaningful community engagement and empowerment for people and communities disproportionately affected by HIV-related disparities and stigma. Support routine standardized HIV screening for all Washington residents. Encourage increased access to access to, I'm going to say, through single payer. Am I in the right place? Yep. No. Sorry.
There it is. Third one.
Yep. Through single payer universal. Sorry for being goofy. Revise.
You're all good.
Yeah. revise health policies to meet the unmet needs of sexual minorities, and work to remove barriers in insurance coverage, which we intend to do through a single-payer healthcare system. Lastly, aging LGBTQ population and queer communities, public programs. The openly LGBTQ population spans a large age range than ever before, exposing some gaps in how the community at large is served. Additionally, many LGBTQ individuals would prefer to have community spaces available that do not center around bars and nightlife. We recommend the following, they recommend and we adopt: provide assessments of and training to nursing homes and other medical facilities to ensure they adequately serve LGBTQ elders. Develop and fund community engagement programs specifically for older LGBTQ individuals and LGBTQ youth. Support Parks Department efforts to designate an official Seattle LGBTQ community space. Now, I realize that a lot of this was very local, but what we want from our federal candidates is to support these efforts through block grants, by creating a special commission that works to reduce the disparities for historically oppressed communities, including the ones that we have covered so far and the ones that we'll cover going forward. And having said that, I think that's all we had today. Please watch this video. Let us know if our platform is lacking anywhere. We want your voices. That's why we sent out invitations before. Unfortunately, people have a lot of commitments, and that's why it just ends up being a few people. But we will send this out to the organizations that showed interest. And if you watch this and have recommendations, are in part of either of this community and feel we left something out, please email us at washingtonberniecrats@gmail.com, and we'll definitely get back to you. And that's all I had. Thank you, and keep fighting the good fight.
Oh, excellent. Thank you.
Mm-hmm.
Let me see if I
I will
can
stop
end.
recording.